When you are depressed, it may seem that you never come out of this misery, but even the most severe depression is treatable. There are many different treatment options, from psychotherapy to medication and changing a lifestyle. The truth is, there is no one-size-fits-all treatment for depression, because we are all unique. What works for one person may not work for another. So let's talk today about treatments for depression. Depression often goes away on its own, even if it can take 3 to 6 months. Treatment depends on the severity of depression. The more severe the depression, the more intensive the treatment. Psychologists and doctors use the classification of mild, moderate, and severe depression. In order to determine the severity of the depression, the doctor takes into account the personality, the symptoms, the duration and intensity of the symptoms, and the consequences for daily life and social functioning. It's important to determine whether depression symptoms are due to an underlying medical condition. If so, that condition will need to be treated first. By a mild form of depression, we take a wait-and-see approach. In many cases, simple supporting conversations can have a beneficial effect. A person with mild depression can benefit from only psychoeducation, self-help tools, and some lifestyle changes. So you can do a lot yourself if you have mild symptoms. Medicines are of little use. Staying home from work is also not necessary. Lifestyle changes are an essential part of depression treatment. Even if you need other treatment as well, making the right lifestyle changes can help leave depression faster and prevent relapse. Studies show that exercise can treat mild to moderate depression as effectively as antidepressants. Proper nutrition, enough sleep, a strict daily schedule, and sufficient social contacts can support recovery. If the depression does not improve after 3 months, more intensive treatment is needed. The treatment of depression usually consists of a combination of medication and talk therapy. By moderate depression, psychotherapy can be enough. If you are depressed, it's good to talk about those feelings with someone close to you. But maybe you don't have someone to talk to, or you don't want to bother anyone with it. Sometimes talking only leads to repeating problems without solving anything. A few simple conversations with a therapist can help. Cognitive behavioral therapy is as effective as antidepressants in moderate depression and offers better protection against relapse. It has been found to be useful for a wide range of ages, including children, adolescents, adults, and older people. During the therapy, you examine whether you can deal with symptoms and negative thoughts differently. This helps you to get a grip on your negative emotions so that you can better cope with future stresses. A therapist can help you to get more activities again. In interpersonal therapy, you focus your attention on the role of the relationships you have with others. Relationship problems can have a significant effect on someone experiencing depression and can even contribute to the cause. Sometimes it's necessary to look at personality and which behavior and thinking patterns can be changed. More than half of depressed patients experience reduction in symptoms of depression after psychotherapy. Mindfulness is also a well-known form of therapy and is widely used to prevent relapses of depression. Antidepressants are the most commonly prescribed drug class for treating depression. In more than half of the patients, antidepressants lead to a reduction of symptoms. The more severe the depression, the greater the benefit will be. There are many types of antidepressants which differ in possible side effects. Antidepressants usually don't work right away. It usually takes 2 to 4 weeks before the benefit starts to be felt. If treatment with an antidepressant is successful, doctors usually recommend taking the drug for 6 months to a year. If depression keeps coming back, people use the drug for longer. About half of those people have been taking the medication for 2 years or more. But that's not always necessary, many doctors and scientists think. Antidepressant medications aren't addictive like some other psychoactive medication. Antidepressants, like other medications, have side effects. If you start taking it, you will first suffer from the side effects before you feel improvement. Side effects may include nausea, weight gain, drowsiness, insomnia, dry mouth, constipation, dizziness, anxiety, or sexual side effects. These side effects do not all occur at the same time, nor do they occur in everyone. They can also be temporary. The side effects will decrease or disappear while you continue to use the medicine. All side effects disappear when you stop taking the drug. But it's up to you to decide whether or not the antidepressant has more benefits for you than any negative side effects. Discontinuing an antidepressant medication usually involves reducing your dose in increments under a physician's supervision. You should never stop the treatment abruptly, otherwise you will suffer from withdrawal symptoms. In addition to antidepressants, a doctor may sometimes prescribe tranquilizers, anti-anxiety drugs, or sleeping pills for a short period of time. These drugs don't help against feeling down. They serve as an extra support against fears, tension, restlessness, and insomnia associated with depression. Sedatives can help deal during a difficult period until the antidepressants start to work. Sedatives make you drowsy and make your muscle weaker. The main disadvantage of these drugs is that the longer you take them, the more you get used to them. Such drug tolerance makes people need more and more to get the same effect. That's why you should only take these types of medicines for a short time. If you have severe depression and don't respond well to antidepressants, your doctor may give you other medicines, such as lithium. Lithium is usually prescribed to prevent a new depressed period after recovery from the depression. When you start your treatment, you'll need to have a blood test every week to make sure the level of lithium in your blood is not too high or too low. Your doctor may change your dose depending on the results of your blood test. Lithium only works if the right amount of the drug is in the patient's blood. Sometimes it takes a while for the drug to start working. The most common side effects of lithium are feeling very thirsty, urinating a lot, gaining weight, feeling bloated in the stomach, and shaking. Do not stop taking lithium suddenly or change your dose without speaking to your doctor first, even if you feel better. If you stop taking it suddenly, you could become unwell again very quickly. But don't rely on medications alone. Although medication can relieve the symptoms of depression, other treatments including exercise and therapy can be just as effective as medication but without unwanted side effects. If you do decide to try medication, remember that medication works best when you make healthy lifestyle changes as well. A form of self-help is bibliotherapy. You can read a lot about depression yourself. This gives you more insight into what is going on with you and what can be done about it. This appears to be a good start for improvement, especially in the case of mild to moderate depression. Another option is running therapy. Regular running or other forms of sports, walking, cycling, whatever, can have a positive effect on the depression. If you want to know more, watch this video. Light therapy, also known as phototherapy, is a treatment involving exposure to an artificial light source. Light therapy is mainly used for winter depression, which often occurs when you don't get enough daylight. During light therapy, a person is exposed for half an hour to 1 hour a day for 5 days to a special strong lamp. It's best to start the therapy before the symptoms start, early in the fall. I will address this subject in another video. Electroconvulsive therapy, or ECT, is a treatment that can be used for severe depression, usually if other treatments are unsuccessful. The stigma about ECT is based on early treatments, in which high doses of electricity were administered without anesthesia, leading to serious side effects like memory loss and fractures. ECT may still cause some side effects, but it's much safer today. Another option is self-medication. St. John's wort can help with milder forms of depression. However, be careful, because side effects can also occur and the effect of this wort may interact with other medicines. Therefore, always consult your doctor. Many of you, as well as my patients, ask me often if it is possible to completely cure depression. The answer is, depression can be treated, but there is no cure for depression. If symptoms go away, it doesn't mean a person is cured. Some people get depression once in their life, but depression often happens in episodes. Many depressive symptoms come and go over a period of months or years. Their intensity can change over the course of life. Treatment is important because it can help to keep depression from coming back if you've already had an episode. It can help improve symptoms and minimize their impact on daily life. But many depression patients will require repeated treatment in their lifetimes. Recovery from depression usually has its ups and downs. Finding the right treatment takes time. It may take some trial and error to find the treatment and support that works best for you. For example, if you decide to go for therapy, it may take several attempts to find a therapist with whom you actually communicate. Or you can try an antidepressant but find out that you don't need it if you walk for half an hour every day. So if your depression disrupts your life, don't hesitate. Seek professional help to find treatment that will help you overcome depression. And before you go, make sure you give this video a thumbs up, subscribe and share this information with others. Thank you for watching. See you next time.